As a national organization, our work impacts many lands across our wonderful country, and I am chairing today's meeting from the City of Toronto, which is located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and we are most grateful and respectful for the use of this land. I'd like to start out just with a couple of housekeeping items and the agenda. So after some informal introductions and items at the beginning, we'll be moving on to some details to enable you to get the most out of this session today. A very quick little intro to Mental Health Research Canada and the National Initiative on Eating Disorders. Followed by that will be a research presentation about 10 minutes long, and I'll tell you a little bit more about that in a moment. And then we will be moving into a fireside chat with two tremendously courageous people that I have had the pleasure and the privilege of meeting with. And I know you are going to find this session very, very informative and insightful. And I'd like to upfront thank all of our participants today, our researchers and our caregivers who are making this event possible. Some housekeeping items. I do want to issue a trigger warning. This is a very sensitive topic. There's some content that some may find disturbing. So please do keep that in mind as we go through the session today. That being said, we think this is very important content to share and raise awareness about. The session's being recorded. Because of that recording, we are able to offer this after the event today, a few days from now. So if you'd like to watch it again or share it with family or colleagues or anyone in your network that you think would benefit from viewing the video, we have a lot of traffic to our pre-recorded videos from past webinars. So that link will be made available to you after the session. We encourage questions. Please submit through the chat function only. The chat function will be expertly monitored by my colleague, Brittany Sabb, who's our Senior Communications Manager. And I will pause a couple of times through the session today to see if there are any questions that we're not planning on covering or that we think are particularly relevant. Can't promise that we'll get them all answered, but we will pause for that. If you're interested in this topic and would like to learn more, please contact Wendy, who I'm going to introduce you to in a moment. She's at NIED. Her email is there, and we will provide it again at the end of the session. And she's very, very happy to have follow-up questions, content, outreach. That's what she's here for, and that's what their organization is all about. Just a reminder to our panelists, keep your camera on when during your presentation section, and then keep your camera off and stay muted through the other sections. I think that will just maximize impact for our participants. And we very much appreciate feedback at MHRC. It's very important to us that when we put time and energy into planning events, that we get feedback, and we'd love feedback about how useful the content was, ideas for other sessions that might be related. We're doing this for you, for the audience, to share knowledge, and we want to be sure that we are putting effort in ways that are useful and needed. A couple of quick comments about both organizations. If you're new to Mental Health Research Canada, we're a national charity. We're committed to improving the lives of Canadians by advancing mental health knowledge. We have a number of areas of work. We support early career researchers through studentships and fellowships. We partner on co-funding grants and managing grant competitions with an engagement of people with lived experience. And we are the organization in Canada that is tracking and reporting on the mental health of Canadians. Everything we do in partnership with others. We are a highly collaborative organization, and for this particular event and initiative, we're so proud to be partnering with the National Institute National Initiative for Eating Disorders. Wendy, I'm so sorry. I always trip over initiative and I always say institute, but that's because of the tremendous work you're doing. In my mind, I think of you as an institute. NIED, N-I-E-D, NIED as they're called, have been partnering with us for the past year, and we work together on some qualitative research that you're going to hear a little bit about. My last comment on that is that core to our belief at Mental Health Research Canada is that people with lived experience must be involved in the research process. And in fact, knowledge is most useful if it's generated with input right from the beginning of the establishment of the research question with people with lived experience. And that is how this partnership evolved. And you're going to hear a little bit about that work and some focus groups that have been run both with people with eating disorders as well as their caregivers. And with those comments, I'd like to give the microphone, the virtual microphone, over to Wendy for a moment to tell you a little bit about the wonderful organization, the National Initiative for Eating Disorders.
Thank you, Akila. 12 years ago, out of sheer desperation and frustration, I started NIED with my two co-founders, Lynn Koss and Patty Perry. For 10 years, we were an all-volunteer, not-for-profit, but now we are also proudly a registered charity. NIED exists to give hope and support to individuals with an eating disorder and their caregivers. I will continue later.
I think you wanted to dedicate the session today, Wendy.
Yeah.
Did you want to do that now?
On behalf, I was just waiting for the tribute. There we go. On behalf of NIED, we have given our heartfelt condolences to the families of Jolene and Lindsay. Their parents came to NIED many years ago, looking and searching for help and answers. As we know, there are still too many questions and not enough answers, and I dedicate the session to them and to their families. Thank you.
Thank you, Wendy. That really brings the harsh realities of this terrible disease home. And, you know, many in the audience may be shocked to know that this is the second most deadly mental illness in Canada. Top of the list is death due to opioid overdose, but this is number 2. And I want you to think about that for a moment, because that's a shocking statistic. And that is why we are here today. And that is why we think there's so much value in raising awareness about eating disorders and about caregivers of people with eating disorders. And I hope you're really going to find today's session very interesting and very useful. And we encourage you to follow up and do what you can to reach out to NIED after this and to help us raise awareness about this important, very important and deadly disease. We're very, very pleased today to have 2 esteemed researchers with us that are going to share with you some work that they've been doing to help us further along this initiative. Dr. Jennifer Couturier is a medical director of Eating Disorders Program at McMaster Children's Hospital. And Dr. Gina Dimitropoulos, I'm sorry, Gina, if I mispronounced that. I have an unusual first name and I'm used to hearing my name pronounced in all kinds of ways, so I hope I got close there. She is the Associate Professor of the Faculty of Social Work at the University of Calgary. So very pleased that the 2 of you made it such a high priority to share with us today the work that was done, and we're very interested to hear where this work landed. So with that, I will turn over to our 2 esteemed researchers. Thank you again for being here.
Thanks so much, Akila. It's a real honor to be here today to present our project that we have almost completed in collaboration with MHRC and NIED. Thank you so much for collaborating with us. The tribute really brings home why we're doing this work. And it really is a passion for Gina and I. So I'm so happy to be able to present here with my wonderful colleague, Gina Dimitropoulos. So I will ask Brittany just to advance to the next slide. We're going to tell you a bit about this project that Akila mentioned, which was to have a focus group on research priorities. And this is our presentation overview. So we're going to give some background, talk about the objectives. Gina will talk about the methods and the research process, as well as our results and conclusions and ideas for the future. Next slide. So as we all know, everybody on this call will know that eating disorders cause significant impairments in mental and physical health. There's severe disturbances in thoughts and behavior, as well as medical complications. Eating disorders have one of the highest mortality rates of all psychiatric illnesses. They're costly, they cost about $24,000 per individual in 2017 to 19. I'm sure that's gone up in the last few years. And eating disorders are very common, affecting 3 to 6% of adolescents in the general population. Next slide. So we wanted to, I'm not sure if we missed a slide there. Thank you. So in addition to the impact on individuals, there's also an impact on caregivers. There can be disruptions in employment, plus the burden of caring for someone with an eating disorder and the feelings that go along with that, guilt, shame, sometimes helplessness. And caregivers themselves are at risk of developing mental health concerns due to the caregiver burden. Thus, there's an urgent need to better understand what caregivers feel is important for researchers to be researching so that they can better support their loved one with an eating disorder. Next slide. So the purpose of our research was to study research. It's actually research on research, but we wanted to bring together a group of caregivers and youth to ask them what would be their most important topics of research related to treatment for eating disorders. And we wanted to hear their voices so that our research is relevant and aligned with those most impacted with eating disorders, and that leads to better treatment. Next slide. So our research objectives, again, were to co-identify the research priorities and recommendations from the perspectives of youth and caregivers. However, today we're going to focus on caregivers. And as I mentioned earlier, this was in partnership with MHRC and NIED. So the question we posed to our group of caregivers was, what are the main priorities for research on eating disorders or disordered eating from the perspectives of parents or caregivers of loved ones with lived experience? Next slide. And at this point, I'll hand it over to Gina.
Thank you so much, Jennifer. So I'm going to talk a little bit about how we did research to understand from the perspective of parents, caregivers, and youth, their priorities for what kind of research needs to be led in the field of eating disorders. As Jennifer mentioned, a lot of times researchers are the ones who are driving the research that's being conducted, and what we wanted to hear from the lived experiences of those who are so profoundly impacted by this illness. What are the questions that you think are critical for us to be addressing in partnership? And in order to do this, we wanted to bring an unbiased and rigorous methodology that would help us to really generate the priorities from the perspectives of parents. So it's called, the approach that we use is called the nominal group technique. And that's just really a fancy way of saying it's using a consensus building approach that allows people to generate ideas for how to solve a problem, how to maybe generate ideas about an area of interest for them. And also it's an approach that's used to help determine priorities, again, in a very kind of methodological and rigorous way. And the NGT methodology is also designed to really ensure that there isn't an imbalance in whose voice gets heard more in the focus group, so that everybody's priorities are identified and ranked accordingly, so that there isn't any perceptions of bias or an imbalance of power of people who are participating. So we can go to the next slide. So this is the approach that's used in this methodology, and we want to share this with you because we think it's really important for you to know the steps that we took to get to the place where we could really hear from families what the priorities were for research from their perspective. So the first step is to pose the question that Jennifer shared earlier, and then we have people silently generate ideas and write them down, and they don't have to share with us what they wrote down. But it's to really kind of like think creatively about where are the gaps, what's missing, what could we be doing as a community in partnership with people with lived experience differently to address unique areas of research. So they did that, and then we start to go around, whether it's in a round robin fashion or people kind of volunteer who wants to go first, and people start to share their recommendations, which are transcribed like verbally and in writing. We use a whiteboard and we like literally write down what people say in verbatim, because again, we don't want as researchers in any way to be putting our perspective on what we're hearing. We want to make sure we ask people as we're doing this, did we get this right? Is this what you said? Is this what you were hearing? And then the next stage in the NGT panel is to then have a discussion. So we really ask people to reflect on what they heard. Were there any other ideas that maybe now they've have developed based on the conversation that has emerged as a result of listening to everybody share their perspectives on research priorities. And then as a team, we go spend a lot of time reviewing all of the recommendations and collapsing them in a way, again, that doesn't in any way create a priority, create a preference for some areas over others. And then we send a survey to all the participants, and then they rank from 1 to 10 their top research priorities. Next slide. So the next step in our research, again, just to quickly highlight, is we have people complete a demographic questionnaire, which is really just sharing kind of a little bit about who they are as a person. So we can then describe a little bit our participants who took part in this study. And of course, Jennifer and I are incredibly committed to like protecting people's identity and confidentiality. So we go to great lengths to ensure that if we have any information that could potentially be identifying, that we remove that, even though we're collecting demographic information. And then, as I mentioned, we send out a survey where people have fairly quickly after the panel, so that we can get people's priorities in ascending order. This is just really to highlight our participant demographics. The majority of the participants identified as male, and we had also a very diverse sample of people from different ethnic backgrounds. And we also asked people to identify who they had interacted with in the broad community of service providers. And so we had people who had interactions with lots of different providers as well. Next slide. Okay, so this is the exciting part. These are the priorities, and we're going to highlight the top 3, given the limited time that we had, we thought it would be good to share the top 3 with all of you, and we're going to go through them sequentially. So the first one, and we frame it as a research question because that was our goal in our partnership with the Mental Health Research Foundation and with NIED, is what are the research questions that families have? So the first one was, how can we improve the education and training of healthcare providers from anywhere from like family docs to paramedics to emergency department staff in eating disorders? The second top research question was, what operating procedures or protocols should be adopted by providers when working with people with eating disorders? And then the third one was, what are the best practices, emerging practices in eating disorders, in eating disorder treatment and care for people with lived experience, their parents, caregivers, and families? And next slide. So I'm going to talk a little bit now about the first priority in a bit more depth. So what we heard and our kind of what led us to generate this this research question is that the participants shared with us, we need to improve training in early intervention for eating disorders and more prevention efforts. We also heard that care needs to be patient-centered, that we really need to be thinking about how to all the care that we offer, that it needs to be centered on the lived experience, and for us to be maybe doing more research that really kind of helps think about what would that look like. We need to raise our understanding and awareness of eating disorders, particularly in frontline providers. Again, I want to highlight, people talked about not so much specialty eating disorder clinics that, in like the programs where Jennifer Lee works, where I work, but what about, in other settings, where in emergency departments or in primary care with family docs who maybe provide general care but have a less eating disorder experience? We also heard that there's a real bias sometimes in who gets identified as having an eating disorder, so we need to do better in raising awareness of how eating disorders do not discriminate. They afflict people across different communities, ages, ethnic, racial, and economic backgrounds. And we also heard that we need to become more aware. Healthcare providers need to become more aware of existing eating disorder resources. Okay. And then the second priority is just a few things that I want to highlight, is that what we heard from families is the importance of bringing a trauma-informed care approach to frontline work for eating disorders across all types of services. We need to, again, develop protocols. There's an absence of even like guidelines or practices or protocols outside of specialized eating disorder programs, and sometimes within eating disorder programs as well, to know how to respond best to support people. And then when people get discharged from eating disorder programs, what we heard from families is what protocols can be put in place to really help people and to support them when they leave treatment as well. And then the next slide, the third priority. So examining best practices for eating disorder treatment and care, we heard that we need to really prioritize specific elements or aspects of treatment. We need to develop best practices within higher levels of care. What that means, higher levels of care, I mean to really kind of think about, in an inpatient unit or in emergency departments where there's more intensive care provided, and then examining supports for people who are living in a larger body. How do we best support them? And then what are the best practices for addressing the needs of caregivers, siblings, and other extended family members in the treatment of eating disorders? And then next slide, which is our last slide. So in conclusion, in future directions, we're really excited to have been given this opportunity, again, by the Mental Health Research Foundation and NIED, and so grateful for their support and the funding that allowed this research to happen. This is the first of its kind, this first research of its kind, to really hear from the perspective of caregivers about their priorities for eating disorder research. So we think this is going to be we hope it'll be a very impactful study that will then help, other organizations that are, have the task and the responsibility of providing funding, that they'll hear kind of their priorities that came out and then pursue doing more research in these areas that have been identified by caregivers. So I want to just thank you all for allowing Jennifer and I, such a privilege for me to present with her, to do this work with her, and all of you to have this work done and for us to share it today.
Well, thank you so much to the both of you for the work and for being here today. It's tremendous work, and we hope it's the beginning of more to come. Brittany, could you perhaps choose a question to ask? Oh, you're on mute.
Every time. We did have one question asking for a little bit more information about trauma-informed care. The exact question is, what does trauma-informed care actually mean? And can you give any examples on that?
Do you want me to answer that, Gina, or do you want to go? Okay. To me, it means that we acknowledge that people have experienced difficult or even traumatic events in their life prior to when we have met them, and we need to be cognizant that we don't want to recreate trauma when we are treating someone. For example, in the hospital scenario, we would want to be very careful about restraining someone in order to provide treatment, thinking about how to intervene in the least restrictive way when we're treating someone in a hospital setting. That's the most clear example that I can think of. But Gina, would you want to add to that?
No, I thought you did a beautiful job responding, and maybe what I'll do, if it's okay with you, I can respond to the next question about
Actually,
or would you like
yes,
me to do
sorry,
that?
we're actually a little bit over time. And I just want to comment on one thing, if that's okay. I know you both did focus groups, both with people with eating disorders as well as caregivers of people with eating disorders. I think in the essence of time, we presented the priorities from the perspective of people with lived experience, people with eating disorders. But we have put together an infographic based on your work, a very simple 2-pager that is available on our website. So if anyone listening would like to hear a little bit more, but in a sort of a snapshot, 2-pager, that's available on our website in a resources section that we're going to give you a link to a little bit later. So thank you both so much for being here, and I'm sure there are going to be some questions for you, so we will see if we can get some of those questions answered post event. Thank you so much again. Appreciate your commitment to this important work. So now we're going to move into a fireside chat with 2 individuals who are living with and dealing with this every day. We have Dave Gervais, who is the father of a 19-year-old daughter. Her name is Natalie. And Wendy, who you've already met, who is the mother of a 38-year-old daughter. Her name is Amy. And rather than me introduce them, I'm going to ask them to introduce themselves and tell you a little bit about why they're here. And let's start with you, Dave.
Hi, everybody. Can you hear me okay?
Yes.
Oh, great. First of all, I want to thank you all for being here. By no means am I any better than you in going through these experiences, or as a caregiver, or where your particular position is at in time. But I do have that experience of living it and going through it. So that being said, I'm hoping that in sharing my story that you receive some comfort that you're not alone in this, that there's a lot of us out there that are around to support you. And that there's lots of resources that will come out of this. And I know Wendy, she may not remember, but she certainly was somebody who reached out to me when I was going through this in my time with my daughter, Natalie. And, to give you a bit of a reality that this is a marathon, it is a long road, but to also in that there's some hope for you and your family and what you're going through. And then lastly, that in sharing my story, that on some level, there's a connection there we can break down some of those stigmas that are out there and take some steps, you know, to save lives. And that's what we're about. So yeah, thank you. And I'm looking forward to the conversation that we're going to have.
Thank you, Dave. Really appreciate you being here. I know it takes a lot of courage to talk about these very personal issues, but hopefully this session will help others to feel some comfort and give them access to resources and personal suggestions as well. Wendy.
Hi, everybody, and thank you all for being here and for listening. I'm just going to share my story with you, and I find it just easier for me to write things down so that I don't get off track and that I can keep myself grounded. I am a caregiver to our daughter with an eating disorder who at 38 still lives at home with my husband and I. I want you to also please bear in mind that this is my story and our experience with the unforgiving world of eating disorders. When NIED launched on February 22nd, 2012, I was on national TV for 30 seconds, reading our story, and my name and phone number was displayed along the bottom of the screen. Not even an hour later, the first call I got was from a family whose daughter had died by suicide exactly a year before because of her eating disorder. Since that date, my phone, emails, and text messages have not stopped, mainly from caregivers desperate for help. Our daughter has been fighting, challenging, and struggling with her eating disorder for well over 2 decades. She has missed out completely on all the teenage, adolescent, and young adult life experiences. In reality, there was very little help for her, and sadly, in our family, not much has changed. As a caregiver, it is so hard to not only witness her physical decline, but her mental torture is agonizing. Her anxiety, franticness, and what she describes as her brain keeping her stuck and not letting her move forward has paralyzed her ability to progress. Her quest for finding answers to her physical issues is unending. Aside from her family doctor, I have taken her to a dermatologist, gastroenterologist, allergist, and neurologist. She has a psychiatrist, endocrinologist, and is waiting to see a rheumatologist and internal medicine doctor. The wait times for these appointments is excruciating, and maddeningly, these doctors operate in silos, so building a team of care for her has been impossible. She is so schedule focused that anytime she feels she's running late, her panic, mood, and disposition flies off the deep end and all hell breaks loose. She gets totally tangled up with her own self-inflicted deadlines and times to get stuff done. When I think back to my daughter's early teenage years and taking her regularly to a pediatrician, I was included in her visits, could ask questions, and be with her. When she moved from pediatric to adult health care, I would take her to appointments, but because of confidentiality or her choice, she would be seen by herself. On the odd occasion, she would share what went on and what was next. By her early 30s, she was too sick to think, talk, or remember any significant medical concerns. So she asked me to sit in on her appointments. She would ask my opinion or get me to answer for her. She had no voice, was so quiet, too weak, and needed me by her side, as any conversation went totally over her head. It is so critical for caregivers to take care of themselves. In our case, we had a wonderful therapist with decades of experience whose guidance was an invaluable lifesaver. No caregiver or family should ever feel alone. Thank you for participating and listening. Thanks, Akila.
Thank you, Wendy, and thank you, David. And I do want to mention again, if you've joined us a little bit late, I do just want to give a trigger warning that we are dealing with some sensitive content today. Just want everyone to be aware of that, but we do think it's important to share this information firsthand. So David and Wendy, if there's anyone listening today that thinks but isn't sure that a family member or a child or a friend may have an eating disorder or may be developing an eating disorder, what are some of the signs and symptoms that you noticed that they might benefit from hearing about? Dave?
Yeah, so I can dig into a little bit from our experience. So our daughter, we figured before we actually had a formal diagnosis of eating disorder, Natalie was suffering with it for about 1.5 years. And something that was surprising to us, both my incredible wife and I are in education, and we work with students, and we didn't even see this happening in our own child. What we noticed were very small changes in eating behavior. So, for example, we would go out, and grab some Mickey D's, and she would want to have that McDonald's, and by the time we would get there, she'd change her mind and give us some reason, and we thought, okay, maybe she's just not feeling it. She also used to be quite athletic, so we noticed that she could no longer finish a lap around a track. She used to run track, and we didn't make a connection at the time. We thought maybe it was some other thing, lack of iron or something along those lines. And then we also noticed that she was really not eating as much. She was being very selective. And we thought, well, maybe this is just a phase. It's going to pass. So all of these things were early signs. And as things progressed, we noticed there was mood change. We noticed that there was avoidance to come to the table or go to family meals, or that she would go to the washroom after eating something. And then it progressed even further, and we noticed even a change in wardrobe. So wearing a lot of baggy clothing, and then some more significant things started to happen. We could see physically occurring outward, such as hair loss, just discoloration, and then we could start to see some weight loss. So that's when things started to raise flags for us, and then we started to get her to see some medical attention at that time. So those were some early signs anyway.
And David, was that over a few days, few weeks, few months? Can you give us an idea of the time frame that you noticed those various changes?
Yeah, that progressed probably over, I would say, almost close to 1 year. And Natalie doesn't mind me sharing her story. In fact, she wants me to. So other things that we didn't know at the time, but with Natalie, she was also very high functioning. So in terms of, she's a perfectionist, she's an empath, she's very empathetic. And she had some other things going on as well. So we noticed she's been diagnosed with anxiety disorder, and she had some challenges with cutting. So we learned since that eating disorder has a tendency to line up with some of these other challenges. So had we known that at the time, we would have been able to more easily identify that these are early signs, the disordered eating and these behaviors. Other things we noticed were, she's hiding her lunch, or just her personality changed. It was not her anymore. Any discussion around food, she became very aggressive, and she just could not eat. And we learned that was actually what she described as being a voice in her head. And something about disordered eating and eating disorder is that voice becomes stronger the more malnourished that individual is. And it actually, that's the thing that it takes them over. So eventually it's you fighting this thing that they're struggling with. That's the best way I could describe it. And maybe down the line, I know Wendy will want to share her story, but I can certainly share with you Natalie's depiction of what that voice is for her when the time comes.
Yes, thank you, David. Wendy?
I think what we started noticing, I started noticing, was that my grocery list started to change. Like all of a sudden I could see her scrutinizing labels and wanting to come with me to the grocery store and standing and staring and choosing, obviously what she was looking for in the content of the label. Also at the same time, she wanted to become a vegetarian. And I know, and I hope everybody here on the call knows that not every vegetarian has got an eating disorder. But for her, it was a time for her, it was a way for her to start restricting. I mean, and I'm talking about like more than 20 years ago, and it was like, you want to become a vegetarian? That's okay, become a vegetarian. I didn't think twice about it. So that to me now, what I knew then and what I know now is very different. She also, just like Dave's daughter, she also started to wear very baggy clothing. In fact, even to this very day, I just find she can't tolerate anything touching her skin. So she'll tend to buy, large men's track pants. To us, that makes no sense, but to her, she's comfortable in it. And then, like Dave as well, the isolation, the change of mood. The kid that you once thought was such a happy, content kid growing up. I was just a mom, with 3 kids, and I had no idea. We had no idea that this was emanating. And then just one last thing that did happen, and it's how we found out, was that her high school friend in grade 9 came to tell me that she was throwing away the school lunch. And then we started to investigate.
So when you get to the point where you realize that these symptoms are very concerning and you need help beyond yourselves, or you need medical help, or you want the assistance of a professional, what happens then? So you notice these symptoms, okay, we need a next step. How did you get to that next step, or what was your path forward when you realized you needed help?
You want to go ahead, Wendy?
No, you go.
In our case, we didn't realize this, but we were faced with the challenge that because of Natalie's age, although we would bring her to seek medical attention, we weren't privy to the information that was shared. So we were still really left in the dark and did not know what this thing was that we were dealing with. And there were recommendations given to Natalie to follow up on some inpatient care that we only found out later. But again, because she didn't share that information with us, and being under 18, we weren't able to assist her in navigating that as her caregivers. And the eating disorder was as such that she didn't want to go to these things anyway, right? She just wanted to, it was holding her down. In my particular case, I had another colleague of mine. We were in the same building, and her daughter was also facing challenges with disordered eating. And she said to me, Dave, Dave, take an Apple Watch and put it on her wrist. If her heartbeat is below 45 beats per minute, then you've got to do something. And I thought that was, well, I credit her for that one day that I would say saved her life, because as some of you may know, as the body breaks down, it starts eating itself, and it's that last piece is the muscle, and the heart being a muscle, and just everything slowing down. When I put that watch on her one morning, it was 39 beats per minute, and I said to her, honey, I got to take you to the hospital, and she refused to go. And I said, well, either I take you by force or I'm calling the police and we're going in. And so it got to the point where we ended up going to McMaster Hospital, who are incredible, and Dr. C, I see you were on there and helped in supporting us in our journey. But it wasn't until really we got to that stage of, her life was at risk, that we were able to get into all of these services and receive all these services. So that's the challenge that we're facing right now in Ontario, is how do we get the services to families and kids who may be in waiting.
Wendy?
For us, I actually remember writing a note to her pediatrician and giving it to them, like at the not without her being there, saying what we thought was going on. And then I remember distinctly taking her to their pediatrician when she was about 15, I think. And she literally had a tantrum on the table like a 2-year-old, saying because the doctor had said, you have an eating disorder. And she went crazy. I don't have an eating disorder. And it was awful. And when I think back, and I guess fortunately for us, so much of it is a blur from so many years ago, sadly. But I remember going for an appointment at a hospital and speaking to them who wanted to admit her. And she managed by a hair to keep herself on the right side of wrong, so that we never had to admit her, like Dave had to admit his daughter. We never ever had to do that. The only time I've ever done that is when, and it was a couple of years ago, 8 years ago, when she was so dehydrated that she asked to go to Emerge to be rehydrated. But otherwise, we never had to actually physically pick her up and take her to hospital. She just managed to avoid that.
So two very different paths here. I'd like to shift the conversation a little bit and talk to the both of you about you as caregivers. I'm interested to know how this has affected you, your family, your work, your lives. David, I know you work in education. Sorry, Wendy, David, I know you work in education. You mentioned that, and I believe you're secondary school vice principal now, so you're around young people all the time. Has this changed the way you work? Has this come into clear focus for you on a daily basis when you're around children, or anything you'd like to share about yourselves as caregivers that you would like our audience to know?
I know Wendy and I have talked about this, but the eating disorder doesn't just impact your loved one. It can take out a whole family. Everybody's impacted. So our other daughter, our day-to-day, my wife had to take time off work, so to try and manage getting to appointments. On a personal level, as you go through it, you're in a bit of a fog because you don't know what to expect. You feel helpless and hopeless and lost, and you're not quite sure how to help your child, and you're doing the best that you can. And that's why these types of places to come are so important. On a personal level, moving beyond that, as an educator, I worked as a vice principal as a principal in an elementary school setting for 10 years. And then I moved it recently here into a high school setting. And it really is about how we talk about food. So I'm doing a lot of advocacy work right now to change food culture and how we talk about food, and even to reach out to parents that are here thinking about this. For example, sometimes we label food like, don't eat that, that's your junk food, eat your healthy food first, for example. And that could start things off early days for children. The language we use about making comments, oh, I see you lost weight today, really great job, but you may not realize it, but we're starting to plant the seed very young. And the other big area that we really hone in on is social media. So for example, my daughter, Natalie, she got on to TikTok, and she started following a group of influencers, and their whole group's goal was to lose weight. So these folks were posting stuff on how much weight they lost daily, ways to lose weight. So, in that space of being isolated and having a support group for the negative thing, that might be something to look into as well. But yeah, just trying to do a lot of work. And at the end of the day, and I think this is what it came out to, is that early intervention saves lives. So before it becomes a full-blown eating disorder, if we can curb the behavior, improve children's self-esteem, make them realize what's out there, and to really look at loving themselves, it is a good start anyway. Mm-hmm.
Thank you. Wendy, how has this impacted you as a caregiver, or you and your family as caregivers?
It doesn't end. I think the stress for my husband and I is, honestly, it is 24/7. With Amy living at home, seeing her every day, her mood in the morning can be absolutely amazing. And by the time after lunch comes, it can flip entirely. Like this, she's like a different person. So for us, truthfully, it's ongoing. It's relentless. It's endless. When she's out and she phones me, my heart still sinks. It skips a beat. because we've had so many dreadful phone calls over the years. So for us, what we just try and do is go swimming, do some yoga, go for walks, have a dog. Thankfully, we've got 4 wonderful grandchildren, and just seeing them and hugging them and being with them is a real big pick-me-up. But it's difficult, you know, she's not capable of living alone. She's not capable of being independent by any manner of means, socially, financially, physically, emotionally. So we just have to carry on. I mean, I don't know what it's like to not live like this, sadly. I know what I would wish for myself, for us as a couple, but we don't know any different.
If I could add on to what Wendy's sharing too, I think one of the things that really helped in this is the realization that the eating disorder is separate from Natalie. So, you know, we quickly to identify somebody if they have cancer, they have, you know, they are not cancer, they have cancer. So you're actually battling a disease. And I think because you can't necessarily see it outright like you would a broken bone or cancer, it's harder to frame and manage and what that looks like, and to understand that, again, the less that they eat, the stronger that the disease becomes, and it really takes them over. So it helped me a lot as a caregiver to separate my daughter from the disease and focus all of our attention on combating the sickness and not combating my daughter. And in doing that, you know, we hear a lot from a lot of people with a lot of advice and saying, why doesn't she just eat, or why don't you just do this, and why do they don't do that? They don't understand. And that was something to that was hard, right? Immediate family, they don't understand, they don't get it because they haven't experienced, and nor would have I. Like I didn't understand what was going on. So
David, your comment around you're fighting the disease, not your daughter. You'd mentioned that when you and I met earlier this week. I think that's a really important concept to underscore, and great advice for caregivers. Wendy, what do you want caregivers to know?
Just building on what Dave has said, we're at a stage now with Amy where her eating disorder behaviors are nothing like they used to ever be. That part of her has really settled down. So I don't feel at this point that we actually are still fighting with the eating disorder per se. It's everything else that has come out of us, like all her physical pain, her mental anguish, her mind, her day is just totally around food, shopping for food, cutting food, measuring food, eating the food, buying the food. Like her whole, it's like she's on a treadmill inside her head with this food going round and round and round and round. And how does she stop it? And how can we help her stop it? And it feels helpless and hopeless. How are we going to sort of get into her little brain and, you know, try and do things differently? I just said to her this morning, I wish she could have an MRI of her brain right now and see where it's at to stop the fire that is going all the time.
I just saw a question flash by my screen about, did other people in your circles of influence or family try to tell you what to do? David, you sort of referenced that a moment ago and said they don't understand. Any other thoughts or comments on that? I'm sure there are people who have opinions in your family and in your circles.
I've just found it very difficult to sort of, I think one thing we've learned is to let go of people who just don't understand, because it's so difficult and it's such a draining, exhausting illness to live with. You know, you have cancer, you know there's going to be treatment, and I can share this with you that, you know, 6 or 7 years ago, our older daughter had stage 1 breast cancer. Thankfully, to this day, she's amazing. But within 3 weeks, she had a 5-year plan laid out for her. And with Amy, here we are, 2 decades and more, still going, still no end in sight, and people still not understanding. It just goes on and on and on. It goes on and on with us, and it goes on and on with the healthcare system and with the government and everybody else.
I was just going to ask what needs to change in the treatment process. So that was a great segue into that. So it sounds like for other illnesses, there are well-prescribed plans of action. But what I'm hearing is there really isn't a plan of action. I think, David, you referred when we met earlier this week about the reentry plan into the home after hospitalization, that was vacant, that discharged and then you were on your own without support there. So what really needs to change here about this illness and the treatment paths that we have available or don't have available?
I want to just go back a little bit. I think education really breaks down the stereotype that's around this disease. It's not, you know, a young woman who's trying to lose weight to look good, like we may have been, you know, put in our minds with the models from the 1980s. This disease affects everybody, all ages, all sizes, all cultures, backgrounds, religions. So it's extremely prevalent. And I think by getting information out there so it's not so hidden, that people know what it is, they have an understanding of what it is. We need to continue that so that when our family members hear, oh, you know, somebody's been diagnosed in your family with an eating disorder, the response isn't, well, they just need to do this. They have a little deeper background knowledge, I guess, and some stereotypes breaking down. So
we need to raise a lot more awareness.
A lot more awareness. In my particular situation with Natalie, we would have had an ongoing care plan, but unfortunately, because she turned 18, she moved into an adult phase. So they called it aging out. So she moved out of the program and the care plan that she had to the point where she's 18. And then once she's 18, that becomes really self-directed again. So it's a matter of convincing her to follow up on going to the appointments and getting the care that she needed. And she did not do that, unfortunately.
Wendy, what needs to change?
I don't know. It's difficult to say because, you know, there's been so many times I have said to me, what would you like to see? And she's like bits and pieces from programs that she's been in over all these years. I just think, you know, I don't think putting more money into the system is not going to change. I think we are totally lacking in succession planning. And as one of the research questions came out, it was training, and more training. I think there just needs to be an easier, more appealing way for people and professionals to want to go into this area of medicine. And I think, you know, until that happens, I don't know what will happen to the situation. And God, my grandkids grow up and there's no help available, you know. So I think succession planning and training is huge. I think, to me, that is the bottom line, because we have heard, and I'm sure they, you know, and I know other people on the call have heard the most ridiculous things said to them in Emerge or wherever, and it's not the doctor's fault. It's because they haven't been trained. You can't blame anybody. It's the training, and more training.
And I go back to education. We need to get programs into schools. We need to reach out to families and parents and let them know, and look at the culture and what we're perpetuating and not perpetuating, so that we can catch this early. We have protocols in place, so we know that if there's a young person in our care or in our building and we're seeing some of these markers, let's look at that and let's go deeper into that. So we have those things available and ready so that we can catch it while it's still disordered eating and doesn't become an eating disorder. So again, the early intervention piece.
And I think also, just going back to like elementary school or even preschool, I think this labeling of good foods and bad foods and any of that kind of talk should be abolished, you know, and not even spoken about.
Yeah, our message is all food is fuel for your body. And I love what we brought out of McMaster, which was food is medicine.
Yeah.
You know, and education needs to be the cure.
David, would it be okay if we shared a picture on screen of you and Natalie?
Yes, please do.
And then I know you have a picture and an explanation.
Yeah. So there's Natalie. Natalie is, she lost her hair because of her eating disorder, and she wears it proudly, that's for sure. And you know, she will say to you that she still wrestles with it daily, and she has highs and lows, but what she's gone through, she's got some skills to work through it, fortunately. And I'm gonna have to close my screen here, but I'm gonna share a picture with you, what Natalie shared as.
So while David is pulling up that picture, I'm mindful of time. I'm going to ask our panelists one more question after this, and then I'm going to ask them to stay on for another 5 minutes to hear some questions from the audience. So understanding some of you may not be able to stay for that, but just a reminder to follow up with Wendy if you have other questions. Sorry, David, go ahead.
So this is Natalie. In part of the work that she was doing, she was asked to actually come up with a drawing of the eating disorder to help her frame it a little more. So this is her drawing of what her eating disorder voice looks like. She labeled it Connie. But in myself as a caregiver, when I saw that, it really helped me to understand that, okay, this is what I'm dealing with, right? This is what we're fighting, and you can only imagine what she's going through based on this drawing. So I just thought it was important to share that to help other people to get an idea that you know, what's going on is very dark and challenging, and maybe it'll help people frame it and identify it a little better in their mind. So I just that's it.
Thank you for sharing that. And Wendy, I know that your daughter wrote a very powerful poem that is on NIED's website, and we've linked to it in our resource section as well on our website. Resources, we don't have a lot of time, but if you had a suggestion around what resource caregivers should consult. I know there are a number, and we do have the list from both of you on our website that we encourage people to go to. And of course, NIED has a lot of resources as well, but comments around what you advise in that regard.
There was one that was given to us in the early stages. It's called Help Your Teenager Beating Eating Disorder, and it's put out by James Locke and Daniel Lagrange. And they're both pediatricians in this field, and that's certainly one that was passed on to us from the McMaster team, and it certainly helped us dig into it and get an understanding for it and some possible next steps. So I recommend that one if you're starting your journey with this.
Thank you, David. Wendy?
I found a support group downtown Toronto called Sheena's Place. That was my lifesaver. I prefer to be, I was just so grateful that this free organization exists, and that, to me, I share that with all parents who contact me, is to get into a support group or find some, you know, a support group near you. And I think because of COVID, so much is online now that it doesn't matter where you live in the country, you can hopefully get onto some Zoom where there is an active support group run by professionals. To me, that was my absolute lifesaver.
Thank you. I'm just going to pause and see if Brittany has one or two questions from the audience that she might like to pose.
Sure. Thank you, Akila. I did have one question that, Wendy, I think that you did just address about advocacy groups dedicated to helping caregivers with getting a diagnosis. And I know that that's something that people may be able to reach out to after this webinar for a little bit more information on as well. I did have one question prior to this webinar that was emailed to me asking about how you support your children in a situation where they might not be with you, like say in an educational or a social situation where they're coping with these feelings that they're having and this illness on their own.
And David, your daughter just moved out recently. I think you may be able to help with that.
We we always let them know that no matter what's going on, you can always come home. So I think that idea that they have a safe spot to land. Now, if they're, across the country on the other side of the world, I know it's extremely challenging. You probably feel very helpless. For that particular situation, try and encourage them to seek some support, depending on where they are. If it's at a school, most schools have, especially post-secondary, most schools have some mental health supports that they can go to. So when they are feeling good and the eating disorder isn't doing its talking, try and encourage them to get in there and start with that for sure.
Thank you so much. And I know that
And-
there was one other question. Sorry, Wendy, did I just cut you off?
No.
Okay. I know there was one other question that Gina mentioned that she could answer, and that somebody had addressed in the chat as well. Gina, if you're
I'd be happy to do that if that's helpful. I won't take up a lot of time. I just wanted to, first of all, just really very, very moved by the presentations, and I want to just share that I think that what I hear from both David and Wendy is not only the pain, but the hope and the courage and the real love and compassion that you have for your loved ones. So thank you for the beautiful presentations about your lived experience. Jennifer and I just want to share with everyone that the point about waitlist was one that came up and is actually one of our top 10 priorities that were identified by caregivers. We just didn't have the time to share all of the priorities, but I think that the reason what the top one that was ranked, and I heard Wendy and I heard David talking about this as well, is that caregivers think we need to be proactive and that there needs to be more prevention and early intervention and more education so that we can identify people earlier on, so that we don't have this, these long wait times for people to get care, because there should be more people who are trained and be able to really respond and across the continuum of care, from family doctors and really support people with eating disorders. So wait lists, you're absolutely right. That is like critical. We have a crisis in this country, and families surely echo that in the work that we did as well. I think they were really setting a priority with number one is we need to do something about this to not be in this perpetual crisis. So thank you for raising that. I really appreciate the opportunity to clarify, because I want the families that are on this call to hear that came loud and clear, and that this is something that is really a critical issue that we need to address through research.
Thank you. David, I meant to mention, I saw something flash through my screen. Somebody else said that your daughter is absolutely beautiful. Absolutely beautiful girl. It's unbelievable. Wow. We have come to the end of our time. We're over time, but I wanted to take a couple more minutes and get some questions answered. I'd like to thank our researchers for their contributions and for being here today. David and Wendy, honestly, I'm not really stuck for words very often, but it's hard to find the right words to thank you. What you're doing is very brave and very courageous, and we hope that, in fact, I'm quite sure that you have helped many people today just by sharing your personal stories, and I hope you will continue to do so. And we wish your families and your daughters well, and just thank you for making this a priority to help to raise awareness about this terrible, awful, deadly disease. Okay. So thank you on that note. Thank you both very, very much for your courage. And we are going to make this recording available in a few days on our website. And we will share it again in social media and through our networks. And Wendy, I know you will as well, through NIED. And so that your contributions today will live on beyond this session, and we will keep it up on our website for probably years to come. So I hope that we're able to improve help and access to resources, and we're with you in your journey to raise awareness. And we couldn't do this without you. It's a privilege and a pleasure to partner with you, Wendy, and I look forward to what lies ahead. And so thank you, everybody. Thank you so much.
Thank you all.
Thank you.
Thank you so much, everyone. I think we're safe to sign off.
Thank you all. So good to see you.
Really
everybody.
appreciate everyone's hard work on this, and
Yeah, thank you. That was
Thank
that was really, really good. I hope it touched some people, and we keep moving forward in a good direction with this.
yes, I absolutely think we will. I think we should continue to connect